Lips have always been a fashion trend and have been a major concern amongst both the sexes. And today we'll talk about lip fillers. So, we're going to discuss a live case where my patient came to me seeking a little bit of lip volume. She did not want to enhance a lot of volume because she didn't want her lips to look unnatural. So, we decided to use Juvederm Lift on her lips. Precisely, we decided to use 1 ml to give a little bit of volume. So, we started by applying the anesthetic cream, which was clean. Post that, we started injecting. The first point we injected was the body of the lip. After giving a little bit on the body center part, we moved on to the lateral part, injecting submucosal. Always be in the midline, in between the border of the vermilions, so that your lips don't evert in or evert out. Then we gently discussed of if she needed more volume or not, on which she confirmed that she was happy with the desired volume. We moved on to the contralateral side, where again the volume was placed onto the lip body. We injected roughly zero point 0.1 cc's of filler per injection site, and then again the same way we injected the lateral part of the lip body, and then we again cleanse the area. We look out for any bleeding points, and then we reassure with the patient if she is happy with the volume or she wants to enhance it further. She said she needed a little bit volume in the central part. Then after, we decided to inject a little bit more onto her central lip area, where she felt she needed a little more volume. Go slow. You can maybe inject multiple times, but then don't overblow with the volume. And also have a consideration that the lip fillers would hydrate a little, hence the volume might enhance a little more post injection in the coming following days. Then we decided to inject the lower lip. Again, we went on to inject the body of the lower lip first. The body of the lower lip was injected. Following the same method, the lateral part of the body was again injected. You're always submucosal while injecting the lips. Please make sure that you compress and stop all bleeding points, because you don't want to end up with bruises. A technique that I follow is extending the muscles a little bit. That kind of gives you the position at motion that the patient will have when he or she speaks. Following that, we assured for the volume part and discussed what we need to do further. Then we discussed if she needed a little bit on the lip border, which she said yes, she would wanted to go for a little bit in the cupid's bow enhancement and the lip border. Yeah, the patient was a little apprehensive, but then she's feeling comfortable as the procedure progressed. The body of the lip is relatively less painful compared to the borders. There can be a little bit. Is then we injected the cupid's bow area, creating the cupid's bow, followed by the lateral borders of the upper lip. She had fairly well defined lower lip borders, so we decided not to inject the lower lip borders. Same procedure we followed, first from medial to lateral. That's the method we followed, and the deposition method was linear threading. So again, per injection we were using roughly from 0.5 to 0.1 cc's of filler. We had injected roughly about zero point 0.8 cc's of filler, followed by the application of fusidic acid or any antimicrobial agent. Yeah, I tell the patient and give her all the post-care instructions, like not to eat or drink anything hot, not to compress her lips, not to exert any force onto her lips, and then let's see what the patient has to say about his or her treatment.
মানে এক কথায় আমি হ্যাপি।
Happy, right? Feel লাগছে, ভয় লাগছে?
না, এখন আর ভয় লাগছে না, খুব ভালো লেগেছে। আর খুব ভালো লাগে, আমি এখানে আসি, এখানকার অ্যাটমসফিয়ার খুব ভালো লাগে, সবার বিহেভ খুব ভালো লাগে, সবাই খুব ভালো। অ্যান্ড থ্যাংক ইউ।
Thank you so much. Give a thumbs up to the camera.